welcome. My name is Professor Davies. I'm a consultant in paediatric endocrinology based at Southampton Children's Hospital in the UK. And today we're going to be talking to Professor Helen Storr about the arguments for the benefits of clinical skills in the diagnosis of short stature. We're very lucky to have Professor Helen Storr, who's Professor of Paediatric Endocrinology at Queen Mary University of London. She has a major interest in growth, from growth screening to new gene discovery in growth disorders. So welcome, Helen, and thank you for giving us your time today.
Thank you.
So well, I'd like to start by asking you, how do you currently balance clinical skill with the use of artificial intelligence and that sort of technology in your clinical practice?
I think it's important to look at the clinical approach to short stature, which encompasses several stages. Firstly, we need to recognise the short stature and initiate referral to either secondary or tertiary care. And this stage requires the identification of short stature. So we need to be able to assess the child's height against appropriate references for age and sex. Also, the child's height in the context of the parent's height, so calculating the genetic target height. And also, we also look at the growth rate if serial height measurements are available. And it's also really important to recognise abnormal growth patterns at different ages. So that's the first stage. The second stage is the clinical assessment. So this encompasses a detailed history, including birth history. It's important to find out about consanguinity within the family, which might predispose to genetic conditions, and a review of systems of every organ of the body that might suggest chronic disease, which may result in poor growth. We're also going to be asking about family history of short stature. So we need to take a very detailed family history, including heights of parents, grandparents, and siblings. And eventually we move on to doing some auxology. It's important that this is done accurately. We need heights, weights of the children, sitting heights so that we can assess for disproportion, and also head circumference. This then goes on to a clinical examination where we assess for chronic disease, dysmorphic features, and we do a pubertal assessment. So this stage should give us clues as the underlying diagnosis. So could this be a primary or secondary growth disorder? So thirdly, we go on to the investigation and diagnosis. And for those children that we think need routine investigations, we do hematological and biochemical screening. We do some imaging. So usually it's very common to do a bone age to look at the skeletal maturation. We do karyotypes in girls to check for Turner syndrome, and we may undertake detailed genetic testing in those where we think a genetic condition or primary growth disorder is suspected. So finally, we then consider the patient management, and we have to counsel the family in detail about potential treatment choices and the consequences of no treatment in some situations. And sometimes we need to also provide multidisciplinary support with psychological assessment and support for children that are struggling with short stature. So artificial intelligence and technology can help us in all the different stages of the patient management pathway, and are increasingly being developed to help us with this. At the moment, they don't replace clinical skills or the doctor-patient relationship, but we can use it as a complementary tool to facilitate and support healthcare professionals, patients and their families. So it's really a combined approach at the moment.
Okay, thank you. That's very helpful. So, if you're thinking of the future, what tasks can you see being increasingly delegated to technology in the setting of growth management, and what are the potential advantages and disadvantages of this process?
Yeah, so there are several examples currently in the growth field. So firstly, increasingly we're using electronic growth chart software packages, which are integrated into hospital systems and patient records. The advantages are that they standardize growth measurements. So this is the first step of the patient journey. And unlike paper charts, the data can't be lost, and we can more easily share the data between different healthcare professionals and specialist teams. The disadvantages of some of these packages is that there are many different types of software being used. All of them have slightly different functionality. They might give different results. And this one concern because it may result in disparities in patient care. Software can be very expensive and it might not be universally available. And this may also introduce some disparities in patient care and potentially treatment allocation. So, for example, if we're looking at children that are born small for gestational age and we have to use a particular cutoff to be eligible for growth hormone, this may cause some issues if the software varies slightly in their interpretation of growth data. Another example is bone age assessment software. So things like Bone Expert, they're increasingly embedded in many hospital systems. The advantages of these are that they free up time of radiologists. They eliminate observer variability and diagnostic errors of manual bone age assessments. They can improve accuracy and consistency of bone age reports, and the results can be obtained really rapidly. So we can get immediate results, and this can really improve workflow because in some situations where there's a big backlog and we're looking at getting reports several months after we've done the X-ray. The disadvantages of some of these softwares are that it's dependent on image quality. So if the X-ray has not been captured correctly, or for example, if there are significant bony deformities are present, it may not be able to detect correctly and calculate the bone age. Also, it wouldn't be able to detect any underlying pathology because it's just trained to report bone ages. And a radiologist would identify those. So these are things that could be missed by just relying on software. There's another thing that is increasingly being used, and this is facial recognition software. It's already being used to identify dysmorphic features of genetic conditions such as Turner syndrome or Noonan syndrome, which obviously are two conditions that are quite commonly cause short stature and present to us. The advantages are it may improve diagnostic accuracy, and for example, it may identify subtle cases which may not be identified by clinicians, or even pick up conditions that the clinician might miss or has no experience, has never seen this condition before. Current limitations of this kind of software is that there's lack of data on younger children and certain ethnic groups, and in these groups, it might be less useful.
Okay, thank you. So, do you think that the technology will increase the options for personalized care in growth management?
Yeah, so I think digital tools are increasingly being embedded into clinical practice, and we know that they can improve healthcare because they automate tasks and assist in diagnostics. But there's also the potential role to predict patient outcomes and really personalize a patient care. So potentially, AI could facilitate personalized healthcare by integrating data from multiple sources. So, for example, if you had omics analysis on patients or extensive genetic data, we could do lifestyle tracking, we could input medical history, detailed medical history details, laboratory testing, so biochemical testing, hematological testing, and then imaging, so radiological images such as the bone age X-rays, etc. we could also put in details about therapeutic responses and also collect data on adherence to treatment. And this could really, if it was all integrated and analysed, it could really provide personalised and targeted management plans, which would be the aim of this kind of technology, I think. So I think the pros of this kind of approach is that we can really start to tailor interventions to each person's specific needs, optimizing outcomes and potentially minimizing adverse effects of treatment. Um, Information could be used to support at-risk patients and improve adherence to treatments. And of course, ultimately, we hope that that would improve patient outcomes. And in the terms of the growth hormone conditions, this could be to do with growth hormone treatment for children that are treated with growth hormone. So some of the disadvantages is that we would need to understand the limitations of all the data sets that are available and how those are interpreted. And the performance of the AI software would have to be critically appraised in real world settings before we introduce them into healthcare systems. And it's important that we do this before we invest lots of money in new AI models. We have to be a little bit mindful of data acquisition because if we're collecting a lot of data on patients and processing this, we could impinge on data privacy. And it's really important in terms of children that we protect children's health data. So that's a consideration. I think we also need to think very carefully about ethical issues because some of the training data sets that are used to help with the development of some of the software programs may have biases. They may not be trained on the same groups of patients. And we want to make sure that all the outputs are equitable so that we don't get any disparity of care. We also need to consider the costs involved with some of these technologies and that make sure that there is universal access to new tools to prevent further inequalities in patient care.
Okay, thank you. Yes, it's a fast-moving field. So if we're thinking about the next 5 years, which technological advances can you see making the biggest impact on the care of children with short stature?
Okay, so if we go back to the patient care pathway, which I talked about at the beginning, I think within the first stage, when we're looking at the identification and recognition of short stature, which is how we pick children up, the development and widespread integration of algorithms which could identify and flag abnormal auxological measurements or growth trajectories could improve the early detection of growth disorders and facilitate earlier referrals, which means that we could assess children earlier and maybe improve diagnosis and intervention and give better long-term outcomes because we know that a lot of growth conditions present quite late. And if we can really improve this stage of the patient pathway, then this could really impact patients in terms of earlier diagnosis and earlier treatment and improved outcomes. So secondly, in terms of diagnosis, things like the facial recognition software, if we could improve that the technology within that and make sure that it's more available widely. And we have increased accuracy for all age groups and different ethnicities. This could be a really helpful tool alongside clinical skills to improve the diagnosis of genetic short stature conditions and recognize other rare growth disorders and improve diagnosis. So thirdly, in terms of the investigation, if you think about genetic testing and diagnosis, sometimes we are requesting multiple different gene panels, and sometimes it takes a long time for those results to come back. So, if we could develop some very accurate machine learning tools to analyze large volumes of genetic data that could identify pathogenic variations in genetic sequences in different genes, we could potentially facilitate a more rapid genetic diagnosis. And many growth conditions do have a genetic basis, so this could be a major advance in this area. Finally, if I'm just thinking about the management of patients, I think what you talked about in terms of personalized treatment, this is a really rapidly advancing field. So, in terms of growth disorders, it would be really good to be able to predict responses to growth hormone therapy accurately, to have tools that could help us with dose adjustment and height predictions, and being able to accurately predict final height during childhood. This would be extremely helpful. So I think that these are just some examples and I think that this field is moving really rapidly, and there are obviously lots more under development. There's huge scope to augment the efficiency and accuracy in this field. However, I think these kind of technological advances cannot replace the clinical skills, and they're obviously not going to substitute for the doctor-patient relationship. We have to remember that children also have individual needs and vulnerabilities and need to be considered in the context of family relationships and dynamics. So I think, in summary, AI should be considered as a complementary tool, but isn't probably at the moment isn't a replacement for healthcare professionals.
So thank you very much. That's been very interesting. So if you were to leave us with, say, three take-home messages for today, what would you wish to convey?
So I think the first point is that the clinical assessment is the cornerstone of short stature management. A thorough history examination followed by short stature screen is really the most important part of this patient pathway, so that we can classify short stature into primary or secondary disorders, give us some clues about the underlying diagnosis. So the second point is that we need to recognize that artificial intelligence and technologies already are augmenting the efficiency and accuracy of patient care in short stature management, but it's currently at a relatively basic level. And the things I mentioned are the electronic growth chart software, and the bone age assessment software. And it's important that when we're using these technologies, we need to understand the advantages and disadvantages of these conditions and the pros and cons of using these. The third point is that we do envisage that new technologies will become available or better developed, and these will help us at every stage in the patient pathway, hopefully ultimately leading to the collection of data that can help us with more personalized treatment plans for children and better patient outcomes.
Thank you very much, Professor Storr, for your very insightful answers. On behalf of Medier, I wanted to thank you for your time today, giving us a insight into how AI may influence growth management. So thank you very much.
Thank you.